Hi everyone, my name is Jesse and I'm an MPH student in the epidemiology department. And for my internship this summer, I worked at Therapy South Alabaster, an outpatient physical therapy clinic that serves a wide range of patients, including older adults, post-surgical patients, and working professionals. So the motivation for my project came from a clear public health need: injury prevention and health literacy in physical therapy settings. As a PT technician, I observed firsthand how many patients lacked a basic understanding of why certain exercises were prescribed or how to continue them at home safely. Physical therapists often have limited time during sessions, and while they provide great care, there wasn't always a standardized way to educate patients, especially those with lower health literacy or different cultural backgrounds. So I designed this internship project to focus on developing accessible, prevention-focused educational materials that physical therapists could use with their patients. So to get started, I created and disseminated a survey to physical therapists and staff at the clinic and other Therapy South clinics in the Birmingham area. I received about a dozen responses, which helped me understand what types of educational strategies they were already using, what topics they covered most, and some of the challenges that they have faced. Additionally, this survey provided me with data on the demographic composition of patients in most Therapy South clinics. And these insights allowed me to better assess the community of patients that I was serving in order to provide them with resources tailor-made to fit their specific needs. Some key themes that emerged were heavy reliance on verbal instruction, common barriers like low health literacy and time constraints, and a desire for more visual, culturally appropriate materials. And so based on these findings, I developed two educational brochures that you can see in the middle of this poster. The first one I called Stay Steady, which focuses on fall prevention and balance training for older adults. And the second one is called Stretch It Out, a guide to desk-friendly stretches and exercises for working professionals who sit for long periods of time. Each flyer includes step-by-step instructions, visuals, and QR codes linking to video demonstrations. And I also added progressions and regressions for each exercises so that therapists can easily adapt the material for different patients, making it harder or easier depending on the need. If you would like to see more details about the results of the survey or the flyers that I created, feel free to scan the QR code at the bottom of this poster. So this project ties directly into the core public health function of prevention. Instead of waiting for injury to happen, these materials are designed to educate patients before they need therapy in the first place, reducing strain on the healthcare system, improving mobility, and enhancing overall quality of life. From a systems perspective, it supports assessment by identifying gaps in current educational practice. It supports policy development by creating standardized resources that promote best practices. And it supports assurance by ensuring patients receive consistent, understandable information regardless of provider or visit length. And this project also integrates public health into a traditionally clinical environment, showing how the two fields can work hand in hand. One challenge that I encountered was making sure the materials were culturally appropriate and accessible to the patients with different levels of literacy. And to address this, I used plain language, added illustrations, and tested the materials with PTs at the clinic to gather feedback. Another challenge was navigating the balance between patient-centered design and clinical accuracy, making sure that everything was simple, but still medically correct and useful. These lessons helped me better understand what it means to create public health tools that are actually usable in real-world clinical settings. This internship helped me bridge my dual interests in public health and physical therapy. It reinforced the importance of prevention, education, and patient empowerment in reducing injury and promoting long-term wellness. Moving forward, I hope to continue integrating public health strategies like this into clinical care environments, especially through patient education and accessible health communication. I would like to end by thanking everybody at Therapy South for allowing me the opportunity for this experience, and specifically my preceptor, Dr. Ethan Kicker, for his support and advocacy during my time in Alabaster. I feel a lot more confident in my knowledge of both public health and physical therapy fields after this opportunity. And that would not have been possible without the help of Ethan and his team. Thank you so much.